Hi, everyone. My name is Brianna Williams, and I'm a graduate student in clinical mental health counseling. I'm preparing to work with the military population and their families, which is a population I care deeply about, not only because of their service, but because of the incredible challenges they face behind the scenes and because I grew up in this community. Today, I wanted to talk about something that isn't discussed often enough, and that is the mental health needs of military spouses and children, and a specific gap in our system that's making it much harder for them to get the care that they deserve. Military families experience pressures that most people can't fully understand, such as consistent relocations, deployments, long periods of solo parenting, social isolation, and the emotional toll of uncertainty. These stressors don't just impact service members, they affect the entire family. Spouses often put their careers, their social networks, and stability on hold to follow their service members during duty station changes. Children switch schools frequently, making it hard to build lasting friendships or receive the academic and emotional support they need. These are not just inconveniences, they're mental health risks. And here's the problem: when military members finally decide to reach out for mental health support, too many are met with long wait lists, high costs, or no available providers in their area, especially if they live in an underserved community. One big reason for this gap is TRICARE, the military's healthcare system. And it's because TRICARE doesn't consistently recognize licensed professional counselors, LPCs, as reimbursable providers for military family members. LPCs are master's level professionals who are fully qualified to provide individual, family, and child counseling. Yet in many cases, they're not allowed to serve these families through TRICARE. That means that a huge part of the mental health workforce is essentially locked out, even as families are waiting months for care. A 2023 Blue Star Family Survey found that 44% of military families struggled to find mental health care for their children. Among those who did get help, nearly 90% had to wait over 3 months. That kind of delay can be the difference between someone coping and someone breaking down. According to RAND, spouses of deployed service members report significantly elevated anxiety, depression, and PTSD during deployments, and children often show increased emotional and behavioral problems. One Institute of Medicine study of over 250,000 Army wives found 39 excess cases of depression per 1,000 spouses when deployments lasted over 11 months. These numbers aren't just statistics, they represent families living under chronic stress, often without the mental health support they need and deserve, which makes this not just a family issue, it's a national readiness issue. If our military families aren't supported, the entire system fails. That's why I'm asking lawmakers, especially those on the House and Senate Armed Service Committees, to support legislation that does two things. Number one, recognize LPCs and LMFTs, which are licensed marriage and family therapists, as TRICARE authorized providers for military spouses and their children, not just for active duty members. And number two would be to streamline credentialing and reimbursement so that these professionals can start helping military families as soon as possible. There are over 140,000 LPCs in the U.S. that are trained, licensed, and ready to serve, but current policy is holding them back. And military families serve too. They sacrifice stability, predictability, and often their own well being so that their loved ones can serve this country that they love. Expanding TRICARE to include LPCs for spouses and children is a simple, impactful step toward giving them the care that they need and deserve. So if you're a policymaker, I urge you to support this change. And if you're watching as a fellow counselor, advocate, or military family member, please share this message. Let's raise our voices together. Thank you. And I have also linked below all the sources that I've used in this presentation. Thank you.